Okay, so I'm arriving with my ambulance service on the scene. I'm surveying the scene to make sure it's safe to approach, and it does appear to be safe. I've put on my BSI, and I've asked any bystanders if there's a sample history they can give me, what happened. There are no bystanders in this case. I have what appears to be a single patient lying apparently unresponsive on the ground. So I've checked my scene safety and I have my BSI. First I'm going to have my partner go and hold C-spine, and then I'm going to approach the patient to check their responsiveness. Are you okay? Can you hear me? She's unresponsive to verbal, so I'm going to check pain responses, pinching her earlobe, and she seems to be unresponsive to pain as well. So quickly I'm going to check her breathing and look, listen, and feel. And I see no respirations at this time, but I do feel a pulse. I'm going to I'm going to drop in, since she's unresponsive, I'm going to do a modified jaw thrust and put in an OP and 2 NPs, and have another one of my partners come and assist with her ventilations with 15 liters of oxygen to work with her. So her airway is now clear, and we're assisting her ventilations. I did get a pulse carotid, and there is a pulse, a radial pulse as well. I'm going to quickly check for bleeding with my gloves. Just quickly check down the body. And there's a little bit of blood on this left leg, but it's not gushing or spurting at this time, so it doesn't need immediate attention. Okay, so I'm going to do a rapid scan from head to toe just to look for other life-threatening injuries. So I'm going to very gently feel the head, look at around the back side, and around the neck, looking for tracheal deviation or jugular vein distension. I see none of that. Make sure that the collarbone and shoulders are intact. Check the shoulders 1 at a time and 2 at a time. Check the chest for integrity and feel the sternum. She all seems to be fine. She does have some bruising and crepitus on this side of the chest, so I'm not going to squeeze in on that side, but I'm going to take note of that. I'm going to palpate all 4 quadrants of the abdomen, which are soft, and squeeze in on the hips to see if they seem stable, which they do. And then quickly slide my hands down, feel the size of her left thigh and knee, check for distal pulses, ask her to push down and up. This side I do see what appears to be a femur fracture, so I'm not going to palpate that, but slide my hands down the rest of the leg to see if she has, to see the difference in size between the legs. I'm going to check the distal pulses on this side and maybe do a quick Babinski reflex to see what she has there. So at this point, I would say this patient is a high priority for transport, and call immediately for backup. I would call for ALS support, and possibly a helicopter if we are a long time out, or a paramedic intercept on the way. So at this point I'm going to do a little bit more detailed primary assessment. Including rolling the patient up to look at their back and putting them on a backboard. I guess I'll just do another head to toe. Or actually, I want to assess their respiratory rate, rhythm, and quality, which I probably should have done during the breathing part. well, she's being bagged now, and so her rate, rhythm, and quality have improved completely because that's right, she was not breathing before, and now we're assisting her with ventilations. In circulation, I needed to assess her skin color, temperature, and quality, and she's pale, cool, and diaphoretic, so I would suspect shock. And she's already getting 100% oxygen, so we're treating that, but I'll cover her with a blanket as soon as I finish my assessment. So I think at this point, I'm going to check the back side of the body and roll her onto a backboard as we get ready to transport her. So my partner's holding C-spine, and with another person, I'll roll her towards me. This is her injured leg, so we're staying off of that, and she has an injury here as well. And just run my hand down the back side, and I don't see any differences there. Roll her back down onto the backboard. We would load her up and put her in the ambulance and perform a secondary assessment at that time. So in my secondary assessment, I'm going to start at the head and again feel for any deformities, decap BTLS on all areas behind. I'm going to look behind the ears for battle signs, looking for raccoon eyes, feeling around the eye orbits and the mandible and the maxilla, making sure I don't see any deformities or contusions or anything like that there. I'm going to look through the cervical collar, looking for any difference in tracheal deviation or jugular vein distension. I'm going to feel out through the collarbones and the shoulders. I'm going to assess the sternum, make sure it's still intact. I'm going to feel the chest, being careful to stay away from the obvious injury there, but making sure that the chest wall is intact. I'm going to look for bilateral movement under my thumbs, which I see because she is being bagged. I'm going to feel, again, the 4 quadrants of the abdomen, make sure that they're soft and that there's no wincing or signs of pain when I do that. Pressing in on the pelvis again, and again sliding my hands down the legs, taking distal pulses, which I do have, checking capillary refill, asking can you push down, can you pull up, can you wiggle your toes, and doing a Babinski reflex. On this side, I'm going to check this leg again, and if we're already in the ambulance, I would have one of my assistants split this leg or provide traction and recheck after that's done to see if I have better pulses. Also, can you push down, can you pull up, can you wiggle your toes, capillary refill, hoping that the blood is now reaching the foot, and a Babinski reflex. Come to this arm and slide down. There seem to be no injuries over here. Checking radial pulses again, which are regular and weak and rapid. I'm going to listen to lung sounds. To make sure that air is flowing bilaterally in the 2 midclavicular regions and axillary. Now that this arm, well, actually making my way back down the arm, I'm going to ask, can you squeeze my hand? I'm going to look for tenting in the signs of dehydration, capillary refill, and I'm going to take a blood pressure on this arm since I know that it's uninjured. Okay, the blood pressure is 130/92. I'm going to continue my assessment with the other arm. Checking for pulses, checking for tenting. Can you squeeze my hand? And I think that's it for my secondary assessment. And I will transfer this information to the hospital when we arrive.